Hi, welcome to Office Hours. February 1st. Can't believe we're already in the second month of 2024, but here we are. I wanted to take a few minutes today in my Interoperability Office Hours and talk about something that I think is really, really important, and I don't think enough people really know about it. And this is a new use case that was adopted under the Carequality trust framework earlier in kind of towards the second half of 2023. And it's really just now starting to get rolled out and being used actually, we're starting to see pretty rapid growth, which honestly isn't surprising to me. So I thought it was important that you know what this means. So what I'm talking about then is the on the behalf of, also affectionately referred to as OBO use case under the Carequality National Network. So first of all, what is it? Well, good to know that OBO stands for on the behalf of. And then just at the very highest level, this OBO use case basically is a special scenario for participants on the Carequality network who have an EHR system that they use to connect to the national networks, and that acts as a responding endpoint for them under the national networks. But they're also using another tool. And that tool could be some sort of platform, special user interface, some sort of third-party tool that's kind of living alongside their EHR system. And the way it works, it really needs to be able to go out and make queries via the national networks in order for it to perform its function. And so in this scenario, it's going to initiate queries, but it really doesn't have any data to respond back with because it's not an EMR system. And so it's funny because I find this is can seem more complicated than it really is. So let me walk you through what this kind of means in real life. So we have Dr. Shelley. She's a cardiologist. Let's say she's using Epic as her primary EHR system. She's opted into Carequality through her Epic relationship, and her medical history data for the patients that she sees are available there in her Epic system. But she recently purchased a new kind of innovative third-party platform that was designed to help optimize how she receives referrals from other providers. And when you're getting referrals and you're a cardiologist, obviously medical history, a really full medical history information is really important for you before you see that patient. And so she's using this third-party platform to help make those referrals easier with her community of providers. And she wants to optimize her workflow in general. So now, under the OBO use case, when she logs into her referral platform, she can opt to query Carequality directly from there because she might be receiving data via direct secure messaging, via electronic fax, but also wants to see if the networks have any other information about that patient before she sees them. Now, that query could be triggered through her just pushing a button in that new platform's UI, or there could be some sort of automated feature where as soon as she logs in and touches a patient record, the system goes out and automatically requests that data. So there's all different kind of workflows that could be supported in this scenario. But what's important to remember is under Carequality, Dr. Shelley and all participants do have a duty to respond to inbound queries if she's making outbound treatment queries. Well, and of course she is. It's just that she is responding to those queries via her Epic system. And so that's really what the OBO use case was designed. That's the problem it's designed to solve. I am using two systems. One is where all my clinical data lives. It's where I document my patient visits. I'm using this other system to kind of enhance my practice, but I'm not creating new clinical data there. But I am using it, in this case, the scenario that we just walked through, to enhance my ability to make sure I have this full history or view of the patient. And so she is able to, under OBO, she is within compliance. She can initiate out of one system she can respond using her Epic endpoint that already exists on the network. So what's the bottom line? If you meet the prerequisites, if you qualify, you can query for patients from one software platform and respond to queries using your EHR or any other system that you have, which is where Carequality participants come to retrieve records when you're sharing them. One thing that's just important to remember is that the whole reason why we need to do this is that when you're initiating queries for treatment under all the networks, really, you have a duty to respond. And so Carequality, I think, being always kind of on the leading edge of where we're going from a nationwide data exchange perspective, was realized that we had a number of situations where we have these innovative digital health platforms that providers are using that are sitting alongside their EMR systems. And those systems also need to be able to leverage nationwide data exchange and to make sure that that provider can have the best possible experience in that particular digital health platform. So, and I think one piece that we often don't talk about, but also is really important to remember, is that this OBO use case also helps everyone on the network, all the participants. And that's because if we really didn't give those digital health platforms any way to simply point back to the EHR system that actually holds the clinical data, then those digital health platforms would have to try to come up with some type of information to respond with. And there really isn't a lot of options for them if they're not creating new clinical data. All they're going to have available is data that's already in the EHR, already available via the EHR system. And so this would create duplicate data. So if I queried both the digital health platform for that data, as well as, in this case, Dr. Shelley's Epic system, I'd be getting back exactly the same data. And you'd have to have some sort of interface between the digital health platform and the EHR in order to get that data, in order to respond. So, that adds a lot of cost to the system, to really no value, because there's no new clinical data of value to the network. So that's, I think, bottom line, one of the reasons I'm most excited about this new use case. As always, when we're working with national network implementation guides and use cases and purposes of use, the devil's in the details. So there are some prerequisites for participating in the OBO use case under the Carequality Trust Framework. First of all, I think this is obvious, but the provider's EHR must be participating in Carequality. So they must be a Carequality implementer. And the provider needs to be opted in. So you can't say, well, Epic's on the network, but then not be participating, as an Epic provider in that exchange. So that's a very important point. In addition, we've talked about this several times already, the new digital health platform or software being used to make those initiating OBO queries cannot be used to enter or create new clinical data that isn't in the EHR. As soon as you are a system that starts creating new clinical data that isn't available elsewhere, then you are responsible for being a responder and making that new clinical information available via the networks, if you're going to be initiating queries for treatment. And then finally, there's just this need to notify the responding endpoint. In our little scenario, that would be Epic, that in fact you intend to use the OBO use case. And so it's typically helpful to have the provider or provider group that's actually the one that's using the technology. Obviously, they have to be part of that communication, but it's fairly easy to do this notification simply using the Carequality technical contacts. And so far, we find that process seems to be working smoothly when people follow it. So I think I've already mentioned why this is so important. I think that in order for us to continue innovating, in order for us to continue innovating in healthcare IT, in order for us to reduce duplicative data that you're receiving back when you make queries, and just add a lot of efficiency to the system, the OBO was absolutely an important and necessary use case. And I hope that the other networks, eHealth Exchange and potentially even TAFCA moving forward, recognize why this was important and adopt a similar scenario under those networks also.